Okay, so these two things happened in the last 2 weeks. One, our IT guy came and okay, so these two things happened in the last 1 week. Okay, one, our IT guy came into the office limping, and my staff asked him, "What's wrong with you?" And he says, "It's my gout." And I was like, "You're IT in a gout clinic and you haven't made an appointment or talked to anybody?" And he says, "Not a big deal. I take anti-inflammatory medications like ibuprofen and Advil, and they help and usually last about 1 to 2 weeks, and then I'm fine until the next time." I said, "Well, you kind of need to make an appointment, but I really didn't make a big deal of it." Okay. The second thing that happened is one of my groups, someone mentioned, "Why do you keep talking about other treatments for gout? After all, I take ibuprofen. I take 6 ibuprofens and 6 indomethacins when I have gout attacks, and it takes care of it." And I thought, you know what? I think it's time for a public service announcement. My name is Dr. Arinola Dada, and I help people with gout pain get rid of their pain without killing their kidneys so that they can live active lives. Okay, let's talk about this thing. Okay, so anti-inflammatory medications are available over the counter, and so you can just keep taking as many as you want. But that could cause a serious problem. So, jokes aside, that can cause a serious problem, and that problem is kidney failure. So, people who have gout usually have, to some degree, their kidneys are probably not working as well as they should. In fact, people whose kidneys are not working as well as they should are prone to gout attacks. People with gout can end up with kidney disease because they end up with too much uric acid, and sometimes it clogs up the kidneys, right? So when we talked about tophi and lumps of uric acid that don't get resolved, and they can also get into the joints, but they can also form lumps in the kidneys. So those people are already a little bit prone to having kidney issues. Then, to add insult to injury, they start taking ibuprofen and indomethacin. Yes, you can say, "Hey, that's what my doctor prescribed during the last time that I had a gout attack," but your doctor is monitoring your kidneys and your liver. When it's not being monitored and you're just taking a boatload of anti-inflammatory medications, because you're right, it will treat your gout. But I have had so many patients referred to me from the kidney specialist because they took ibuprofen, indomethacin, Advil, Aleve, and they damaged their kidneys. So you can't just be taking anti-inflammatory medications. Yes, it stops the attack, right? The attack is your body is making uric acid. Uric acid is being dumped in your joints. It is creating an inflammatory storm. The anti-inflammatory medications, ibuprofen, indomethacin, Aleve, Advil, all reduce the inflammation, and so you feel better faster. In fact, the sooner you take the medication, the sooner you feel better, and hopefully that prevents you from accumulating a high dose. So that's all fine. Problem is, you cannot take it endlessly, right? You keep having attacks every month, every other month, and then you take a load of anti-inflammatory medications. They can damage the kidneys. Primary way that anti-inflammatory medications damage the kidneys is that they reduce the blood flow. So when your kidneys are starved for fluid, starved for blood, then they get damaged, right? And so if you're taking a lot of that, anti-inflammatory medications can cause a decrease in blood flow. They also cause damage to the filtering apparatus, and they can cause tubular damage. That's what it's called. So what am I trying to tell you is that you cannot just self-medicate with anti-inflammatory medications, especially if you, one, have a history of high blood pressure, right? If you've ever been told that you have problems with your kidneys, you cannot take anti-inflammatory medications because, one, you are not solving the problem. The problem is you're making too much uric acid, and you need to stop making uric acid, right? And there are medications that are available for you to stop making uric acid. The anti-inflammatory medications are just like a band-aid on the problem. So just because you took anti-inflammatory medications does not prevent you from having another attack in a month, 2 months, 3 months. And what happens is you keep taking the anti-inflammatory medications and you keep damaging the kidneys. So most people, I'm going to give another example. Most people who have kidney disease are prone to gout. And then if you have gout and you're taking anti-inflammatory medications, then you can make your kidneys worse, right? I feel like I can't get off this high horse enough. You cannot just self-medicate with anti-inflammatory medications endlessly. Yes, you're like, oh, my doctor can't see me for a week. I can take an anti-inflammatory medication. Yes, but not, month in, month out, talking about how you're taking 6 ibuprofen, 6 indomethacins, to get rid of your attack multiple times a day. You will end up with kidney disease. And the kidney disease, that means dialysis, right? So, this is totally preventable. Talk to your rheumatologist locally, get on a medication. There's allopurinol, there's indomethacin, there's Cristexa. Those are medications that are available to stop your body from making any more uric acid. There is nothing wrong with treating an acute attack with indomethacin and ibuprofen, but you can't keep doing it repetitively. Otherwise, you end up with kidney disease. Second thing that anti-inflammatory medications cause is stomach ulcers. Number one cause of stomach ulcers, ask any gastroenterologist that you know, is those anti-inflammatory medications. So a lot of times I have people take something to protect their stomach. They're called proton pump inhibitors, and they protect your stomach from ulcers, right? So one other way to prevent damage to your kidneys is to increase your fluid intake. So if you increase your fluid intake to some extent, remember I said that one of the ways that it causes damage to kidneys is that it reduces blood flow to the pipes, and the pipes go to the kidney. Well, if you flood the pipes with fluid, with water, not beer, right? Because beer causes attacks. If you flood the system with water, then you can increase the blood flow and minimize the side effects from anti-inflammatory medication. So if you learned nothing else from anything I've told you today, anti-inflammatory medications do treat gout, but self-medicating with anti-inflammatory medications long-term, unfortunately, can cause kidney disease, and kidney disease can lead to dialysis, right? People with high blood pressure are prone to kidney disease, and they're also prone to, and so with kidney disease, they're prone to gout, right? So we want to make sure that we're not making a bad situation worse. So please see your primary care doctor, see your rheumatologist, make sure at least you have a physician, getting some blood tests to make sure that your kidneys are tolerating kind of that impact of the anti-inflammatory medication. So that is actually my story for today. My name is Dr. Arinola Dada. I'm here to help people who have gout pain improve their joints, maintain a good, healthy joint life. If you are in the greater Seattle area, we're starting a gout clinic just because of the need. But if you're not in the Seattle area, just Google gout doctor, right? Okay. So my name is Dr. Arinola Dada. I'm in greater Seattle area. I help people with gout pain improve their joint function so that they can live active lives without damaging their kidneys. Okay, you guys, have a great day. I'll see you in a week with more questions. Bye.